A warm welcome to one and all. Today I'm going to give an introduction on climate change and human health. Myself, Dr. Indu K. Gopi, a public health scientist, and Dr. Dahi Suleiman, who is working as a research assistant. Both of us will be dealing with the following sessions. So let's start. The most relevant question asked these days is how environmental interaction by humans has impacted our own health. Humans impact the physical environment in many ways: overpopulation, pollution, burning fossil fuels, deforestation, etc. Changes like these have triggered climate change, soil erosion, poor air quality, and undrinkable water. Potential climate change impacts. Before going to the potential climate change impacts, we can deal with what is exactly climate change means. So, there are two reasons for climate change: natural cause and human cause. Natural cause means the volcanic activity, solar output or solar radiation, then Earth's rotation around the sun. Then human causes can be burning of fossil fuels, in which carbon dioxide is a dominant gas, which is a greenhouse gas. Then conversion of land for forestry and agriculture, etc. Now let us look on to the potential climate change impacts. So this is a diagram in which I am explaining on how agriculture, forest, water resources, coastal areas, species and natural areas eventually impact health. So the agricultural impacts are like the crop yields, irrigation demands, etc. Rising temperature and more frequent droughts and flood compromise food security, which can lead to malnutrition. Then forest impact can be change in forest composition, shift in geographical range of forests, and forest health and productivity, etc. Water resource impacts can be changes in water supply, water quality, increased competition for water, etc. Diseases like diarrheal diseases, cholera can also occur. Then impact on coastal areas can be erosion of beaches, inundate coastal lands, cost to defend coastal communities, etc. Species and natural areas can be shift in ecological zones, loss of habitat and species. This all can eventually lead to health impacts, which are like weather-related mortality, infectious diseases, then compromised air quality, which can lead to respiratory illnesses, etc. So the next is the impact of climate change on health. The climate changes can cause ozone deterioration, heat waves, hurricane, forest fire, drought, flood, etc., which can lead to heat-related illnesses, air pollution-related illnesses, waterborne and foodborne diseases, vector-borne and rodent-borne diseases, infectious diseases, etc. And infectious diseases is an example. One of the example is the global pandemic, which is happening nowadays. So the heat related illness can be direct impact and indirect impact. In a direct impact, the heat illnesses, cardiovascular diseases, mental health and renal diseases, etc. can be the effect of direct impact, and indirect impact can cause increased risk of food and waterborne diseases, etc. Then the air pollution related illness can be, we can say that respiratory illness was in the past, respiratory illness was due to smoking and household smoke, etc. Then recently the air pollution is attributed to respiratory illness. Then climate change has already made conditions more favorable to the spread of some infectious diseases. Recently, the wildfire in Amazon, which happened the last year, and the bushfire in Australia, which happened earlier this year, alarmed the world on how zoonotic transmission can occur. Forest encroachment and wild animals brought into the natural human habitat facilitates the spread of infections. Nipah and Ebola are examples of these kind of zoonotic transmission diseases. Then people who are more exposed to air pollution and who smoke are going to get worse if infected with COVID-19, which is a global pandemic. Then we are going to deal with some of the initiatives which happened in the state level, national level, and international level or global level. So the first one is the Kyoto Protocol, which happened in 2005. It is an international treaty that commits the state parties to reduce the greenhouse gas emissions to prevent global warming. There are currently 192 parties to the protocol. Then the next one is the Rio Declaration. It happened in 1992. This is to control global warming, and to preserve diversity of species. Then which is the Minamata Convention. We all know about the Minamata tragedy which happened in the Australian continent, and the Minamata Convention on Mercury is an international treaty designed to protect human health and the environment from anthropogenic emissions and release of mercury and mercury compounds. Then coming to the Brussels Summit. It is a European Union initiative to address the climate change. There is a 20-20-20 deal, which means that by the year 2020, reduce by 20% the emission of greenhouse gases compared to the 1990 levels, then increase by 20% the energy efficiency in the European Union, and to reach 20% of renewables in total energy consumption in the European Union. Then the Environmental Protection Agency. It is a United States federal government agency whose mission is to protect human and environmental health. It oversees programs to promote energy efficiency, environmental stewardship, sustainable growth, air and water quality, and pollution prevention. Then the Kasturirangan report, which is from India. The background of this is that the panel had examined issues regarding the categorization of the Western Ghats, which is the southern part of India, as ecologically sensitive area as per the recommendations of two committees led by Madhav Gadgil and K. Kasturirangan. Few recommendations from the Kasturirangan committee is that there is a ban on mining, quarrying, sand mining, etc. Then new thermal projects is a strict ban. Then, but hydropower projects allowed with restrictions. A ban on new polluting industries. Then a ban on townships, but buildings and construction projects up to 20,000 square meter was allowed. Then forest diversions allowed with extra safeguards. This was the Kasturirangan report. Then coming to the Environmental Protection Act, which came into being in 1986, is an act of the Parliament of India. In the wake of Bhopal tragedy, the government of India enacted the EPA in under the Article 253 of the Indian Constitution. The purpose of this act is to implement the decisions of the United Nations Conference on the Human Environment. They relate to the protection and improvement of human environment, the prevention of hazards to human beings, other living creatures, plants, and property. Then, EPA in Indian context. When coming to the Indian context, India's Supreme Court has ordered the government to open a new institution based on the USA's Environment Protection Agency, aimed at addressing rising levels of pollution across the country. Some of the most known worldwide environmental protection agencies are the Intergovernmental Panel of Climate Change (IPCC), established by UN Environment Programme (UNEP) and the World Meteorological Organization, and the Global Environment Facility. So on the next session, I'll be dealing with the infectious diseases which happen due to climate change. Thank you.